Greetings, my name is Phylliswe Benita Mule from Zimbabwe. I represent the Zimbabwe National Community and the Zimbabwe Evaluation Association. My presentation is on the SWOT analysis which was done on the Zimbabwean M&E system as well as the Zimbabwe Evaluation Association M&E system. I'll start by presenting findings on the Zimbabwean M&E system, and it will be categorized into strengths, weaknesses, opportunities and strengths. And then a bit on the future in terms of strengthening of the Zimbabwean M&E system. Now, as we start, the Zimbabwean M&E system has a strong policy framework which is anchored on the NDS 1 2021 to 2025, which has a clear results frameworks at all levels, and it is very in-depth. It's the first of its kind actually as a nation, and it shows the main direction that the country is taking in terms of accountability. Then the NDS 1 is anchored on the IRBME system and is underpinned by the IRBM system actually. So the other strength of the Zimbabwean M&E system is that it has a good national policy guideline and a good national policy framework. Right. On strengths, the Zimbabwean system has a strong national evaluation policy framework, which is in the form of the NDS 1 or 2021 to 2025, which has clear results framework, and has a clear M&E plans underpinned by the IRBME system. And the NDS M&E framework outlines priorities, targets, and key result areas for the nation. And when we look at it, Zimbabwe is now going in the right direction in terms of evaluation, and it is clearly articulated in this NDS 1. The other key strength of the Zimbabwean M&E system is that it is a vibrant and a functional national evaluation associations which it works closely with, and it has clearly established coordination mechanisms for the implementation of the M&E strategy in the form of a tripartite which includes the Minister of Finance, the Office of the President and Cabinet, and the Public Service Commission. And those are the strengths. And in terms of opportunities, we realize that Zimbabwe has been doing a lot of monitoring, although very little or no evaluations. And so monitoring data is evaluation, which is a useful basis for evaluations. And then the role of donors is recognized, and the role of donors and others, non-state actors, is recognized, and Zimbabwe has a good working relationship with this. And then the Public Service Academy, which is one of the tripartite members, has established a Public Service Academy for reorientation of civil servants in terms or in line with this M&E direction, and this is a good opportunity for the implementation or the strengthening of the M&E system. Then the system recognizes provincial and chiefs councils as critical in the monitoring of the NDS 1 in the lower tiers of the government. Then the National M&E Framework, that is the NDS 1, has left out the task of developing sector-specific outputs and activities to the relevant ministries and departments, which is a good opportunity for participation at the lower levels. And then the the existence of advanced M&E subsystems like the Ministry of Health or the Ministry of Primary and Secondary Education is a good opportunity for the Zimbabwean M&E system. And in terms of weaknesses, the first one is the inadequate resources to fully support the system, and the second one is that the personnel that are supposed to implement the M&E activities are not adequately skilled. Zimbabwe is now establishing sub-units in the different departments, and the personnel is not skilled. Then learning is not clearly articulated in the national M&E frameworks. And also there is no disaggregation of targets according to gender and income level. And Zimbabwe has not had any evaluations or any significant evaluations in the past. And as such, the baseline data that is outlined in the M&E systems is based on extrapolations, and that data could be flawed, which could maybe actually mean that the targets have been set based on wrong baseline values. And there is a lot of indicatorism where the country is focusing on higher level outcomes, and this could compromise the implementation process because there is that issue. Then there is a lot of fragmentation in terms of the reporting structure, especially at OPC, where there are 3 departments within the Office of the President and Cabinet, and all of them are focusing on M&E. And now reporting from lower levels becomes cumbersome, which maybe we can also term as reporting fatigue. And finally, there is low morale for implementation, for the implementation for the implementing officers or agencies because of low salaries. Then the threats. The first one is that autonomy is not explicitly stated in the M&E frameworks, and the other one is that there is a weak culture of accountability and learning. And specifically, we can say there's been a lot of corruption. Then there is a lack of strategy for effective integration of M&E results, and fear of accountability could actually result in the setting of low targets at departmental levels. And the last one is that there could be resistance of the more advanced subsystems to be integrated in the main national M&E system, which is still at the infancy level. Now we move on to the SWOT analysis of the Zimbabwe Evaluation Association, and we are the first one being that it's a registered entity. The government is committed to strengthening and working with the evaluation. There is a comprehensive national M&E policy framework within which the ZIA is operating, and ZIA has a comprehensive strategic plan to provide direction for the next activities. And it also has strong linkages with partners, that is academic, civil society, UN agencies and government. And finally, the diverse backgrounds of the association members promotes a culture of learning and sharing. And then in terms of opportunities, there is an increasing national demand for accountability and learning, which makes ZIA very relevant. There is political will to strengthen monitoring and evaluation at national level, and recognition of ZIA by government and other stakeholders is a good opportunity. And in terms of weaknesses, the first one is the issue of resource limitations, similar to the one which was identified for the Zimbabwean M&E system, and there is limited membership base, lack of full-time personnel, weak retention strategy for members, weak alliance with the other localness, which is the Zimbabwe Evaluation Society, and there is lack of representation from people who are influential in cabinet or parliament. And finally, the threats, These are similar, they are similar competing services offered by the other nurse, and the impact of COVID doing nurse business it has had a negative impact. It's a huge threat. Then in terms of future plans, there is need to develop a comprehensive membership and retention strategy, forge a working relationship with other local nurses, and revise the strategic plan to promote equal and fair representation in the executive board. Thank you.